There is a first-degree burn, also known as a superficial burn. That's the kind of burn you don't normally get when you go to the beach. Now, in severe cases, you can even have blistering with the superficial burn, but that's not always the case. So that right here is a partial thickness burn. You can see how it's like it looks patchy, kind of, right? You can tell there's more extensive damage to this patient. This would be done with like an actual fire, some boiling water, things of that nature. Partial thickness again. This one actually has blisters, really, really big blisters. And this is your full thickness burn. At this point, the skin is so tight from the burn that this patient might not even be able to expand adequately to bring in oxygen, because if your skin is so tight, it won't expand and allow your thoracic cavity to create that negative pressure. So as far as estimating the percentage of surface area that is damaged, we have what's called the rule of nines. So the body is divided into different sections, and every section is about 9% of the body surface. Adult body is divided into 11 main areas. Each represents 9% of the body. Now, for children and babies, that changes, okay? And it's on you to go over those and memorize which section is what percentage. So here, I would take a picture of this. So just the thoracic cavity alone, the front is 9%. The back is another 9%. So if the front and back are burnt, that's 18% of the body. Okay, so that's how that works. It's every section. So the section you're actually looking at, and yeah, as the kid gets younger, there's more surface area and accounts for more. So like, for example, the baby's entire head is 18%, and the child's too, but for an adult, the entire head is only 9%. So the geriatric note, moderate burns in a young adult can be fatal for a geriatric adult. This is for two different reasons. One is that geriatrics, meaning the elderly population, cannot compensate as well as young adults. Also, is if a patient can feel a burn, it's most likely that it's a pretty bad burn because their nerves are not working as adequately. So their sensation is diminished, it goes down. So when your adult patient, your geriatric patient is actually feeling the pain, you should really pay attention, because it means that there could be a really dangerous issue going on with your patient. And this also includes burns, obviously. Pediatrics, the issue with pediatrics is that they have more surface area. So they have more surface area than they have internal in the container. Not sure if, okay, let me use a different example. Let's get this baby right here. Let's say that let's pretend that this baby was blown up, right? And we turn this baby into the size of this adult. So this is the adult, and this is the baby blown up into the adult size. What we mean by more surface area is that since we blew this patient, this baby is now grown, and we blew them up, and they're as big as an adult. In comparison, this adult, let's say that the adult and the baby, let's pretend they're containers, okay? Let's pretend they're containers. This adult is filled up to blood up to this line. I'm just a made-up example. It's a made-up example. Well, let's pretend that the patient is a container, and from the feet all the way up to the top of the body, the adult patient, only fills up to right here with blood. In comparison, if this was the baby that was brought up to the same size as an adult, in proportion when compared, they have less. So let's say their fluid will be down to like right here where the nines are. They have less internal fluid. and more surface area. So that means there's more to burn, but less fluid to compensate. Does that make sense or no? Does anybody want me to repeat that or say that in a different way? Did it not make sense to somebody? Okay, so because of that, the pediatrics, see, infants and children have a much greater relationship of body surface area to total body size, resulting in greater fluid and heat loss. So they have less fluid than they have surface area, so they can lose more fluid as opposed to an adult patient because of the proportion. All right, so treating specific types of burn. See, patient care for thermal burns. So obviously we want to stop the bleeding, cool it down. Always ensure the airway and breathing are good. If they're not, we want to manage that first before we manage anything else, because if we're trying to take care of a burn while the patient's airway is swelling, it doesn't matter how good of a job we do on that burn, the patient's going to die. So it doesn't matter. It's all for nothing. That's why that's really super important. Obviously, complete your primary assessment. That's where you take care of your patient's airway and manage it, and treat for shock. So you want to evaluate the burn, get an idea of whether it's a 1st degree, 2nd degree, or 3rd degree burn, so we can treat it appropriately and also document it. Again, we're gonna clear the wound, but we're not gonna be doing a super good job. That's for the hospital to do. We just want to clear it to get a good visual and to not have any debris in there. Just take out the debris and secure it in place and bandage it in place how it's supposed to be. The reason that we remove clothing and jewelry is because every time a patient burns or a part of the body burns, that part is going to swell up. If there's jewelry or tight clothes, it's going to constrict that area even more. That's why that's bad. Wrap with dry sterile dressing. You have plenty of that on your rig. For burns to hands and feet, remove patient's rings and jewelry. Talked about that. Okay, the issue with electrical burns is that they burn the patient from the inside out. So initially, the damage does not look as bad as it is. Severe damage to body by disrupting nerve pathways. So the pathway that electricity takes in the body, let's see. I'm gonna use the example of the bullet that was over here. Give you guys a better understanding, I think, of what I'm talking about. Here we go. Let's just pretend that this is the pathway of electricity, right? So this patient got jolted with electricity and it just went, this is the pathway it took for whatever reason. Well, if this is the pathway that the electricity took, what's gonna die first is whatever's along that pathway is dead. It's gonna die, all that tissue. And now your patient's tissue starts to die from the inside out. So over days, this will progress, and tissue damage will occur more and more. And so what initially was just an open wound had an open and an exit wound from the electricity, and it looked like a bullet wound, will progress and cause severe tissue damage because the body and the tissue are dying from the inside out. The electricity and all that stuff that ran through it continues to cause damage to the tissue of the body. So that's the big deal with electricity. That's why that's so scary. Rule of nines, geriatric, pediatric, thermal burns, electricity. All right, so entry and exit burns are possible. We talked about that. Respiratory and cardiac arrest are also possible. There's a whole bunch of electricity running through your patient that is going to jack up the conduction system in the heart for sure. I mean, there's a good chance. Bones may fracture from violent muscle contractions. ABCs, really important. Treat for shock, give oxygen. Talked about that already. I'm gonna play this video for you guys. I think it's a video.
As electrical current passes through the body, resistance to current flow from tissue, such as bone, As electrical current passes through the body, resistance to current flow from tissue, such as bone, results in the production of heat. This heat is transferred to the surrounding tissues, and extensive thermal injury can occur without significant external signs. In addition, injury to the heart's electrical conduction system is common, and lethal cardiac dysrhythmia possible. As electrical current passes